Good morning and welcome to our Wednesday presentation for the GPS Navigation for Caregivers conference. We are so glad that you're joining us this morning. We have an amazing presentation in store for you. My name is Rob Fabian. I am the Director of Marketing and Communications for Age of Central Texas. We are a regional nonprofit organization celebrating our 35th anniversary this year. And we have been serving older adults and family caregivers for 35 years with programming, education, resources, and support so that they can continue to thrive here in Central Texas. We are very excited that we were invited this year by Riverbend Church to help put together this virtual version of the conference. This is the 8th year that Riverbend Church has been producing the GPS conference, and it's my pleasure to introduce Sharon Butler with Riverbend Church. And Sharon's going to tell us about the church and about the conference itself. Sharon, if you will unmute, I'm going to turn the floor over to you.
Good morning. And on behalf of Riverbend Church, I'd really like to welcome you. And we're so glad that you joined us this morning. And hopefully you're catching several of these seminars and sessions this week. So far, they've just been knocked out of the park. Really, really good information. There were several of us family caregivers who started this program 8 years ago when we realized there was a community need for more information. And we've been able to provide that at the church for 7 years, and that didn't happen this year. So we're really excited to be partnering with AGE to do this virtually. And we have some exciting plans for next year to try to do a hybrid presentation. So that will be an exciting thing. At Riverbend, we try to take care of our seniors and our caregivers the best we can. We have a really active support group for caregivers that meets weekly. And later this year, we're in the planning stages for a once-a-week free respite program. So the contact information for those two things will be in your virtual program that you'll be getting here shortly. And also, if you are interested in those when you get your survey next week, if you would fill that out and give us your contact information, we'll be happy to get in touch with you to give you some more information about those things. So Riverbend is all about inclusion and encouragement. We're there for you. We want to be part of your journey. We want to do what we can to help you along this difficult path. It can be really challenging, and we understand every case is different, of course, but we do understand the road, and we know where to find the information for you. So between Riverbend and AGE and Area Agency on Aging and Cindy Cummings, who's our great presenting sponsor this year. Thank you, Cindy. Hospice Austin is sponsoring this session. Thank you, Christy, for being here. We appreciate you guys and all you do in the community. And Dr. Mary Theoptisto, who is with Baylor Scott and White, is going to be giving us some great information today on the latest developments in this awful COVID pandemic. So before we get started, if you don't mind, I'd like to offer a blessing for our caregivers, and then we'll get started. Father, thank you so much for the opportunity to be able to do what we do through the technology and the knowledge that you've given us. We know that this is a hard journey, and when we throw COVID in on top of it, it can be so daunting. We ask your special blessing on those who are dealing with the isolation and the difficulties of getting through this phase in our history that's had such an impact on everyone in our country and in our world. And we thank you for Dr. Theoktisto to be able to come and share some enlightening information with us so that we can do our jobs better. We're all doing the best we can with our families, and we ask your blessing on us and ask you to walk the journey with us and help us to find the joy. In thy name we pray. Amen.
Thank you so much, Sharon. We really appreciate that. As Sharon mentioned, Cindy Cummings is with us this morning. She is the owner of Cummings Home Team and Turnkey Transitions, and we are so grateful that she is our conference sponsor, our presenting sponsor for this year. Cindy, I'm going to turn it over to you and let you tell us a little bit about your business.
Well, thank you, Rob. I'm just thrilled to be a part again of this tradition that's gone on for many, many years. And it's just amazing how everybody has pivoted and changed and tried to still get the word out. And that's the most important thing. I am a real estate agent. I have my brokerage under Realty Austin. My home team is comprised of me and my husband and my son. We have over 40 years of real estate experience. We've added an ancillary business to our current business, and that's move management. Our move management company is called Turnkey Transitions, and we help people move from their home to communities or live with their families. What we found was people just weren't able to get their home sold because they had too much stuff. And so we really help them with the stuff. I am a downsizing coach. I am certified as a coach for downsizing. Sounds strange, but when you start doing it, you'll realize you need some help. We're also a part of the National Association of Move Managers. So long ago, I just determined that I wanted to work with this population. I felt like many people in this age group don't deserve or don't get the kind of care that they have earned and deserve. And so we go the extra mile and help them with these kinds of things. I'm also involved with some other nonprofits. One I wanted to tell you about, it's LT Senior Services. It's out in the Lake Travis area. It's a nonprofit, and their goal is to help seniors and their families in the Lake Travis area. And we're doing a paper shred event, and it's in Lakeway, and it's at Lakeway Aquatic Center. So if you're in that area and you want to drop by your shredding, you can do it for free. We're taking donations for the nonprofit too, but that's just an example of some of the things that we try to provide. Who doesn't have a lot of papers? I know I've been going through all my boxes in my house since I've been stuck in it. So again, it's a free event, but we are asking for donations. And again, I'm just thrilled to be a part of this event and can't wait to hear more from the doctor.
Thank you so much, Cindy. And Cindy is one of the leading experts on senior issues and caregiving issues here in our Central Texas area. So please feel free to contact her anytime you need any information or references, because she is truly one of the greatest sources of information that we have here in our area. So Cindy, we're so grateful to have you with us this morning. We're also very grateful to have Christy Mangum from Hospice Austin joining us this morning. They are our session sponsor for today. And Christy, I'm going to turn it over to you to tell us a little bit about Hospice Austin.
Yes, thank you, Rob. Good morning, everybody. I just want to talk a little bit about hospice services and Hospice Austin. Hospice Austin has been in the Austin area for about 40 years. We just serve here locally all of Austin and surrounding areas. We span Georgetown to San Marcos. So it's a large, and east and west as well. It's a large area that we cover. But just kind of want to talk a little bit about what hospice is. A lot of us, of course, you don't really know until you get to a point where that's something you might even have to be thinking about. And so, it's changed a lot over the last decade, really. A lot of people just really had the mindset that hospice was only at the very, very end, the very just last couple of, days of life. But it actually, they have come to with studies and things have seen that there's so much benefit to getting started earlier on services, and that, your quality of life and just the support for your loved one and for the families is just something that's really beneficial. And so, basically if your loved one is someone that has a life-limiting illness, and they are not pursuing any aggressive treatment, then that would be a point when you would want to start thinking about hospice. And what does that mean, and what does that include? Of course, there's certain criteria and things that we'd have to look at as far as qualifications go. But basically what you would get with those services is you would a physician, you kind of would have your own team. And so you would get a physician a nurse that's dedicated to you. You would also get a certified nursing assistant, a CNA, as well as a social worker to help with just practical needs and planning. And then you also have a chaplain that will be on your team as well. Now, those are things you can or can't, you can refuse those services if that's not something that you want, but it is available to you. And so, basically we come to wherever you call home. Most people want to be in their home. And so our team comes to you. And our services also include any equipment that your loved one might need, whether it's a wheelchair or a walker or, a hospital bed. And then any supplies and medication. And of course, our clinical team helps manage all of that as well. And, a lot of people are always wondering, well, gosh, how much does this cost? Well, hospice services are 100% covered under, Medicare and any of the Medicare plans. But Hospice Austin is a nonprofit hospice. And so we actually, you'll never receive a bill from us. There's never any out-of-pocket cost. We believe that everybody deserves good care, regardless of funding or not. And so that's never a concern and we just have so much support from the community that we're able to offer that, to anyone and everyone that may need those services. And then we also, of course, we have Hospice Austin is the only hospice that has our inpatient unit, which is the Christopher House. And that is more like a hospital setting, but but it really is more of like a home feel. It's just 15 beds, and you've got your own entrances, and so those are just if your goal is to stay at home, then that's going to be our goal as well. But sometimes you've got things going on where you just need a little bit more care, and you need doctors and nurses round the clock. So we do have that available. Also, and so that you don't have to go into the hospital, which especially right now is nice because we've got all these regulations with COVID and everything going on. So that, we are 24/7. I know one of the things that is really a great benefit to our families is that we're able to, if something happens, a lot of times it's in the middle of the night or on the weekends. And so, we're just a phone call to help you kind of figure out what's going on and what you might need. Or of course, we're able to offer a visit at any point as well for those that are on our services. So we would love to, be of service to you or your family. If you're even thinking that your loved one this might be something that they could benefit from, please reach out to us.
Thank you so very much, Chrissy. And I'll mention that Age of Central Texas partners with Hospice Austin almost daily. They are an amazing organization. They also are a tremendous resource of information. So they're another great one that you can reach out to if you are needing information on anything about your caregiving journey or services that are available here in Central Texas. So want to do just some very brief housekeeping, and then we're going to introduce Dr. Theoktisto. As Sharon mentioned, this is the first year we have done the conference virtually. So if we have any little burps along the way, please forgive us. We're dealing with all the tech issues that the storm brought us as much as you are at home. And so we understand that it's been a very difficult past couple of weeks for you. But we are so glad that you are joining us. By the way, if you're having any issues related to the winter weather that we recently had and you need some help, you can reach out to Age of Central Texas. You can reach out to Riverbend Church. We can help you find the available resources in the community to help you out. So please don't be afraid to ask if you need some help. If something happens and you get knocked off of the session today, don't worry. We're recording all of our sessions this week, and we're going to be posting them on YouTube. At the end of this week, we're going to send out the links to everyone who registered to be a part of the conference so that you'll have those. You'll have all the PowerPoints. You'll have all the resources that have been mentioned during this conference. You'll have all of those in one place. As Sharon mentioned, we're also going to send you a survey on Monday. We ask that you please take this seriously and fill it out. It's electronic. It won't take but just a couple of minutes, but the information is very, very valuable to us because it helps Riverbend Church as we are looking toward next year's conference. And we want to know specifically what are some of the topics that we need to research and find speakers for next year to help you in your caregiving journey where you are. That's why we do these conferences, is to help you. And so we need to know what is it that you need. It's then education and information and resources so that we can add that for next year. So please fill out that survey for us. We're going to be also sending you a link to the conference program. There will be a lot of great information in there, in addition to all of our wonderful sponsors. There'll be great information on all of their services. There will be the bios for all of our speakers for this week, but we're also going to include a lot of caregiver resources for you. And so we're going to be sending that to you by Monday. So that'll be available as well. Finally, there's a chat feature that's here on Zoom. It's right down here on the bottom, and it looks like one of those comic strip thought bubbles. We ask you to click on that chat feature, and while Dr. Theoktisto is doing her presentation, ask your questions. Because at the end of the session, we are going to have a facilitated Q&A, and we're going to answer your questions. Remember, this is for you. This is your opportunity to ask questions of one of the leading experts in Central Texas. So ask those questions. That's why we're here doing this. Now, because our time is limited today, we are going to end at 11:30 because we want to be cognizant of your time. If for some reason we don't get to all of the questions, don't worry, we are still going to answer your question. We will email you directly with a reply. So please take advantage of this opportunity. Ask the questions that you've been wondering about. If something is mentioned that isn't real clear to you, ask for clarification. If you've got specific questions about your caregiving journey and how COVID has been affecting that, ask those questions, because this is your opportunity. All right, it is my pleasure to introduce Dr. Mary Theoptisto. She is a wonderful resource here in Central Texas. She is affiliated with the Baylor Scott and White Health System. She attended medical school at St. George University School of Medicine in Grenada in the West Indies. She completed her residency here at the University of Texas at Austin-Dale Medical School as a physician resident in internal medicine. She also holds a residency at the University of Texas Health Science Center in San Antonio as a clinical fellow in infectious diseases. And she's also a member of the IDSA Texas Medical Society. She specializes in infectious diseases, which I know she learned a lot about while being out in the West Indies. And as we know, COVID is an infectious disease. So who better to talk about that than someone whose specialty is infectious disease? Dr. Theoktisto, we are so glad to have you joining us this morning. Thank you for taking the time out and bringing all this great information to us. I'm going to turn it over to you and let you tell us about what we have learned over the past year when it comes to COVID-19.
Hi, thank you, Rob. So I'm Dr. Mary Theoptisto, and as he said, I'm an infectious disease specialist here at Baylor Scott and White Health System. And I'm based in Lakeway. So I'm gonna share my screen. I did a little presentation. So share. All right, and I'm just gonna make sure, Rob, you can see this, right?
Yes, that is perfect.
Okay. So some of the information we're going to go over in the beginning is not new, and then we're going to get into some of the updates since the last time Rob and I talked about COVID. There's been a few changes and some exciting things have been happening. Let's see. So this is overall going to be a COVID update, but I am going to kind of emphasize transmission and prevention again. I feel like it doesn't hurt to go over stuff we know. Repetition is important. You know, this was something that came up last fall, is what to do during travel. I don't think much of that has changed, but we do have some exciting changes as far as vaccines go, and then immunity and variants, and then we'll take questions at the end. So at least since last week, I think we all have seen this in the news. It's a little out of date since I did this, I think, on Friday. But, you know, there's been over 27 million cases in the US, and I think the death toll is now over 500,000. And as you can see, I put these charts in here, and you can see that the morbidity of COVID based on age group, and those are the red bars, it's kind of, you've got a bell curve here. And so a lot of the morbidity is younger people and, 18 to 29, 30s, 40s, and 50s. But then when you move over to the other chart on the right with the blue bars, you can see that, the death rate is more significant as you get older. And so that's the concern. And so why are elderly people more likely to have severe disease? And there's a number of factors that go into this. We think and we know that having more comorbidities puts you at higher risk for severe disease. And as you get older, you're more likely to have comorbidities. And so those are things like high blood pressure and diabetes, other lung diseases. And then as we get older, our immune systems do get weaker. And when they get weaker, we're not as likely to mount that immune response that we had when we were younger to fight things off. And we're more likely to develop cytokine storms. And that's the thing that really puts us in these life-threatening respiratory failures. It also has been shown over the past year that advanced age does result in a decline of clearance of the viral particles. So it may take longer to clear the virus from your system. This is just another chart from the CDC that goes over and illustrates that the number of comorbidities increases your risk of having severe disease. And so you can see asthma puts you at higher risk, hypertension. And then if you have two or more conditions, two or more comorbidities, you're 4.5 times more likely to have severe disease. Or if you have 3 or more comorbidities, you're 5 times more likely to have severe COVID. This is another way of illustrating it. And this is looking at hospitalization in this one bar and then death in the other bar. And so our comparison group is going to be 18 to 29-year-olds. And so if we're comparing people who are 65 to 74, they're 5 times more likely to be hospitalized and 90 times more likely to have a risk of death. And the numbers just increase as you get older. And remember, our comparison group again is the 18 to 29-year-olds. We all know the symptoms. I won't spend too long here. Basically flu-like symptoms can also cause nausea, vomiting, diarrhea. Interestingly, something that is kind of more specific to COVID is the loss of taste or smell. And it might not be loss of taste or smell. Sometimes it's just changes that people report. And these symptoms occur somewhere between 2 and 14 days from exposure. And of course, they can vary. You might not have all the symptoms, you might have no symptoms, and they may be more severe. And then to compare them to influenza, basically the same thing, except the loss of taste and smell. Flu shouldn't give you that. We've seen this over the past year, transmission. We know it's spread through respiratory droplets. There's more and more data now to suggest that in specific cases, it is airborne. And we know that that occurs in poorly ventilated, crowded places, especially where there is loud talking, yelling, or singing. And this is a table that I like these infographics from the CDC. And this just illustrates how easily COVID can be spread in crowded places if you are speaking loudly and not wearing masks. So the red guy right there, he's our index case. He had COVID, he went to choir practice, and then 87% of the people that were at choir practice got COVID. And so that just illustrates again how easily it can spread. And so we know this, not reinventing the wheel here. Wash your hands, continue social distancing. None of this has changed. Continue wearing a mask, continue cleaning and disinfecting, frequently touch surfaces, and always monitor your health. If things change, let someone know. Don't cough into your hand. That's what that's showing us. This is another infographic that it just illustrates the importance of wearing masks and that they work. And so these two hair blow dryers are 2 hairstylists that had COVID, and they saw 139 clients total. Everybody wore a mask and I think they didn't spend much time getting their hair done. I think it was about 15 minutes. But since everybody wore a mask, nobody got COVID. So it just illustrates the importance of making sure you wear masks and making sure that you protect yourself. So travel kind of always comes up, and the answer to this hasn't really changed, even with vaccines. COVID is still out there. We have new variants. We know some of these variants, and I'll touch base on this in a little bit too, are more infectious. And so you still really need to think before you travel about your destination. You know, are there higher outbreaks where you're going? Are things shut down? It's just make sure you do your research if you do decide to travel. And when you travel, who will you be exposed to? Is it a big gathering that you're planning on going to? Are people sick? So even you know, when you're vaccinated, these are still things you need to think about. And again, because if we're traveling and we're older and we have comorbidities, what is your increased risk of COVID, and is it really worth it? And so just continue to think about these things before you go and decide to make any arrangements going forward. So this is the new stuff. Since Rob and I last talked, we now have the Pfizer, BioNTech, and Mrna EUA approved vaccines. Those are both mRNA vaccines. We know that mRNA degrades incredibly quickly in the body. I think that's been a concern for some people, but it should not linger. And it is very effective. And so far, the safety data is very good. One that is up for EUA approval is Johnson & Johnson. This is an adenovirus-based vaccine, so it's not mRNA. It's a little less effective than the mRNA, but it's a single dose. And so kind of looking at the studies overall, it looks like it's about 66% effective on preventing moderate to severe COVID. And the level of protectivity varies by region that you are in the world. So it was a little more effective in the United States than it was in South Africa, and then it was in Latin America. And that has to do with what variant is most prevalent in those areas. So that kind of suggests that it may not be as effective for some of these new emerging variants, but 60% effectiveness, like to prevent a severe disease, is better than 0%, in my opinion. Others that are not available in the United States yet are Novovax and Astrazeneca. I will comment on Astrazeneca. It did show reduced asymptomatic infection, and that's kind of the only study we have right now showing that these vaccines do prevent asymptomatic infections and that they prevent transmission. And so that is going to be key into getting rid of this pandemic and kind of getting back to some level of normalcy. AstraZeneca vaccine wasn't as effective for the variants either. And there's some data that I won't get into as far as how they administered it during the study. But overall, it does appear to be fairly effective. So again, the importance of vaccines, no vaccine is going to be 100% effective. Nothing we have out there is. But the idea of vaccines really is to do two things. And those two things are preventing severe disease, hospitalizations, and death. And that's the purpose of a vaccine. We can achieve herd immunity more quickly with vaccines. It decreases transmission, and most importantly, stopping this pandemic. So vaccines are strongly encouraged. When I'm asked, when should you get it? Kind of the answer is, what is available to you? What is available to you now? And can you get it now? So get whatever is available to you when it's available, is kind of the recommendations that are out there. So, where can you find more detailed information on the vaccine? Any state Department of Health should have up-to-date information by counties on where and when you can get vaccines. So that's the Texas Department of Health and Human Services website right there. And then as far as Baylor goes, and I'll send you this file, Rob, if I haven't already, but as far as VSW goes, If you are a patient, your primary doctor is with us, you should be contacted through your account when you become eligible, one, and then when supplies are there. But if you're not a patient, and if you guys have a phone, there's a little, I think these are QR codes or whatever, you can take a picture of it, but you can register. And then you should, once you're registered, be contacted through the MyBSW account as well. The doses are really only given as quickly as the supply becomes available. And I don't think that we're taking requests for appointments at this time. The scheduling just depends on the supply, really. And so I'll make sure Rob has this so he can forward it to everybody. So I've gotten this question from people, and since both doses, right now we only have the Moderna and Pfizer vaccines, and those are 2 doses, so that's why it says this. But if you receive, you're fully vaccinated, can you spend time with others who are also fully vaccinated and not wear your mask? Or can you spend time with others who aren't vaccinated? So the answer is we're still learning about asymptomatic transmission. And remember, I told you that no vaccine is 100% effective. And so there is a risk with any vaccine that you get for any disease that you could still get the disease and you could still transmit it. And so, this is where mask wearing becomes really important. And the only safe answer that I can really give anybody is until we reach herd immunity, we really do need to continue wearing our masks and washing our hands and performing social distancing. Now, if you're in a little cohort where everybody is vaccinated, your risk of transmitting and getting severe disease within that cohort are probably incredibly low. But this really is the only safe answer I can give you, is just to continue to wear your mask and washing your hands until we reach that level of herd immunity and population immunity where it's not going to overload our healthcare system anymore and people won't be getting severely ill and dying from this disease. So immunity. This is all over the place. We're still determining lasting immunity from natural disease, and now with the vaccines, those are questions that are being answered. This still is true. It does appear that our antibody levels decrease a few months post-infection, and people with severe infections have higher antibody levels. These may last longer. Research is still ongoing. The current data does suggest that immunity may last from natural disease somewhere between 3 and 6 months. We know reinfections can occur. We also know co-infections with different variants can occur. What is still being determined is how long the immunity lasts from our various vaccines and if boosters will be needed, but I imagine boosters will be needed with the variants. We just don't know when and what the frequency of those will be. So there's a lot of new variants. Just as a general rule, viruses are constantly mutating. And so we do expect changes in the structure, and they like to evade the immune system. And so when this happens, variants occur. And this happens with influenza every year, and we're more familiar with that. The current variants that you've heard about in the news are the UK, the South African one, Brazil, and now the Californian variant. It does look like some of these are more infectious, and therefore they can spread more easily and probably a higher risk of airborne transmission. Again, it's being determined if the antibodies that we've developed from our vaccines recognize these variants. So far, it looks like they do. We may lose some efficacy with the South African one. It's still kind of being determined as far as the other variants go. If the virus does spread more quickly and transmit more easily, that means more people are getting infected at the same time. And when that happens, that puts a strain on the healthcare system. We run out of beds and more people potentially can die. So it's still really being determined if the variants can cause more severe disease. But if everybody's getting sick at the same time, the risk of mortality does increase. And I kind of answered this, but so far the data for the mRNA vaccines is effective against most known variants, with some loss of efficacy with the South African variant, and then boosters are in development. And so I think those were the most common questions I've been getting. So now I will take everybody else's questions, and I'm gonna stop sharing my screen.
All right, fantastic. Lots and lots of information there. Lots of information for us to weed through. I am going to show something real quick. We've had a number of people asking about when can I get my vaccine? Where do I sign up? How do I find a place to get a vaccine? I'm going to share my screen and show you the Age of Central Texas website real quick. If you see the button right down here that says COVID-19 coronavirus updates. If you go to our website, which is ageofcentraltx.org, or just Google for Age of Central Texas, go to our website, you click on this link, and we have created a whole webpage of coronavirus information. If you scroll down, here is vaccine information for Central Texas. We've been updating this daily as we get new information, and it will show you who is taking appointments, how you sign up, where you can find the information for all of Central Texas, the pharmacies, their links where you can click on there and get on their wait lists. If you need to utilize Cap Metro to get their information from the CDC and from Austin Health and from Williamson County Health as well. So there's a lot of information there. We continue to update that. Hopefully that can be a good resource for everyone who is looking for where can I find the vaccines. Of course, the question is, because we had the big winter storm last week, and that has really thrown everything asunder. I know people have been trying to get in touch with Austin Public Health that were scheduled for their second doses. They haven't been able to get through to them. Where are we sitting now when it comes to people getting their vaccines locally? Are we going to be behind a little bit, do you think, on getting folks their vaccines, especially those who are scheduled for their second doses?
From what I know, at least I know Baylor did cancel a lot of theirs last week, but all of those have been rescheduled. So there probably will be a little bit of a lag for a few days, but I think everybody's been really good about rescheduling and getting the vaccines out there and distributed when we have the supply. And, you know, we really want to get everybody who wants to be vaccinated. So I think maybe a little bit of a delay, but it shouldn't be that much of a delay. And I think we'll be right back on track.
Super. I know there's also some concern for folks who were scheduled last week and this week for their second dose, and they weren't able to get them last week. And now that things are getting rescheduled, there's a little anxiety about that it's going to be beyond my 4-week window when I'm supposed to get the second dose. Should people be concerned that they are lagging a week or two behind on that second dose, or are they still okay?
No. So it's actually maybe a little bit better that it's waited. This, you know, the studies to approve these vaccines were really rushed. And so that's why 4 and 3 weeks were chosen by Moderna and Pfizer, is because if we said, hey, let's get your second dose in 3 months, you know, 8 weeks, 12 weeks, we wouldn't have these vaccines available. And so there's more and more data that suggests that it's perfectly fine to wait a little longer. We don't know what that time frame is. But you're not going to lose efficacy in waiting a little bit.
That's terrific. That's great to know. And, you know, you mentioned how, well, so much of this, you know, we're still learning as we go because this is brand new to us. What is the difference between a vaccine that went through an approval process and then ones that were permitted for emergency use. So, we've seen some that had longer studies and some that were then pushed through for emergency use. So what's the difference between that process?
So we've had a lot of emergency use gone through this past year, and that's really because of this public health emergency. Most of the time when we have new things come out, it goes through FDA approval. It's a lot more stringent of a process. There are committees that vote for things and tweak out the kinks and go through all of the data. But with emergency use, there was enough data to support the use of these vaccines and enough safety data that the benefits really outweighed any risks of withholding the vaccines. And you can see it even now with decreased transmission rates. When you look at, I think Israel did a really good, I think there's some studies coming out of Israel, and they did a really good job vaccinating most of their population. And they have had a significant decrease in transmission. And they noted that even after just one dose of the vaccine. So the difference is this is an emergency. It's a public global pandemic. And we need all the tools we have to get rid of it.
Right. If a person has had trouble with some of the previous vaccines, like for the flu or the pneumonia, in particular the senior version of the flu shot, should they expect that they might have some issues with side effects from the COVID vaccine as well?
The high dose flu vaccine for seniors can, side effects for that one are a little bit more common. It's a different vaccine base. So, you're using a killed virus for the flu, where here it's an mRNA based. So really, when you look at who had allergies from and severe allergic reactions like anaphylaxis to Pfizer or Moderna, it's not that many per million. I think a couple million when you look at it. And so the people who had severe reactions were people who have had history of anaphylaxis in the past, or have had reactions to the components in those vaccines. And so you can pull open on the CDC and FDA website the components of every vaccine. And you can go through it and figure out if you've ever reacted to anything in it. And if so, maybe that's not the vaccine for you, or you need to be monitored a little bit longer when you've had the vaccine. But it seems to be not a very common thing at all.
And as always, if you're concerned, ask your doctor.
Correct.
They know your medical history. They're going to be your best person to ask. You had mentioned that the COVID vaccines are different than like flu vaccine. The flu vaccine utilizes a killed version of the virus. This one is not. These vaccines do not include the virus itself. So Correct. It's a completely different animal.
So, and it's a really interesting kind of scientific thing we have available to us. mRNA vaccines have been studied for decades. This is the first successful human vaccine. And it's really quite interesting. It just codes a little bit of the spike.
Oh, I think we froze. I think we're having a technical difficulty. It's exactly what we talked about. That I think you're back. Great. I was just going to mention, we had a question about whether someone should sign up on multiple sites on waiting lists, kind of instead of putting all their eggs in one basket. I think the answer to that is yes, because as soon as you get a notice from one, take it. Where we've had supply issues in the past of getting the vaccine into Central Texas area, where it looks like those floodgates are about to open finally, and we'll have a lot more vaccines coming in here to Central Texas. But yes, I would sign up on as many of the lists as you can and get on as many waiting lists as you can, and the first one that offers it, take it. So I'm sorry, you were talking about how that this vaccine is something new. For the history.
New to humans. This mRNA vaccines have been studied for decades. This is not new in the scientific community, but it's new and interesting in the fact that we're basically sending a little code to our body and saying, hey, make this foreign protein, and then our body is like, oh, hey, it's not supposed to be here. And now we have antibodies to the spike protein, and we're able to recognize the virus if we're exposed to it immediately. And like I said in the presentation, there is no reason the mRNA should hang out in our body. It degrades incredibly quickly. So that's not something to be concerned about. And it is a very effective vaccine. It's just, I think it's really quite fascinating.
Excellent. If somebody has had the COVID vaccine, even had their first dose, and then they get a COVID test, are they going to test positive because of the vaccine, even if they don't have COVID itself?
So you shouldn't test positive on PCR antigen. You may test positive for spike protein antibodies, but you may not. And negative tests do not mean anything. It does not mean that you didn't respond to the vaccine. It just means we don't have a way of monitoring those titers that you've developed yet.
Okay. So basically, if you're asymptomatic,
now, if you test positive on a PCR antigen test, you have COVID.
Right.
But the vaccine shouldn't make you test positive on.
And that's the blood-based test, correct? Not the swab and spit test. The test that you just mentioned, which test is that one that if you test positive, then you definitely have it? All right, I think we're still having a few connection questions. One thing that I wanted to point out is that yesterday the Travis County Commissioners approved a plan that they are going to utilize the Circuit of Americas as a mass vaccination point. They're going to do a test run of it this Saturday, and they're going to administer 3,000 vaccines in one day. The plan is that they're going to be able to use that facility because it's a large space, and that will be a mass vaccination site. Their goal is to be able to vaccinate everybody in the Central Texas area by July 1st by using that site. So they need to show the state health that it's a functioning idea. And so that's why they're going to do the test run this Saturday. But they're hoping that by next week, they will be up and running every day, administering somewhere in the neighborhood of 5,000 to 10,000 vaccines every day. Of course, as we mentioned, the issue for Central Texas has been that we just haven't had enough vaccines coming into Central Texas to start vaccinating people who are not in that 1A or 1B category, that being the first responders, folks who are working in healthcare, and those who have the other issues like diabetes, that they need dialysis, they have these other health issues that put them at very, very high risk of contracting the disease. So that's why those folks were singled out first to get the vaccine. And so many other people have been waiting, including caregivers who are caring for someone who is older and is at high risk. And I know that has been a big concern that we have seen. A lot of caregivers are getting very antsy about getting their vaccine because they're worried about giving it to their older loved one. So we're very hopeful that all of us who are caregivers are going to be able to get our vaccines very, very soon, even as soon as next week. So it is very important to sign up on all of those wait lists just as soon as you can. So be sure that you do that, and hopefully within the next week or so, it's going to be opening up the vaccine to everyone in Central Texas who needs it. Got a question about the herd immunity that we've been talking about. In order to achieve the herd immunity, are we looking at needing to vaccinate all the population in Central Texas? So that would include children as well. Are we going to need to include basically every person who's in the area in order to achieve herd immunity? And at what level, what percentage of the population vaccinated do we feel like we're at that point?
I believe the number is pretty high for herd immunity. I don't know, I'm gonna throw a number out there. I don't know how accurate it is, 80%, which is like relatively high. So the more infectious the virus is, the higher herd immunity you need. And that's just kind of the baseline rule. So there are studies looking at children right now. Those are just a little more stringent. And so those will probably come out in the next few months, and then we'll have some more guidelines on when and how we can vaccinate kids.
Great. Had a question about the Circuit of America's vaccination site on who's going to be running it. I honestly don't know. I just saw the story this morning. If you check online for any of the television stations, they have the story and they'll have the details on that. I know that there'll be more information coming out about it, but as I mentioned, it was just approved by the Travis County Commissioners yesterday in their meeting. So it's a developing story, but I'm sure we're going to see a lot more happening with that. We had talked about, you mentioned travel. Are there some safety precautions specifically that people should be taking if they absolutely need to travel, if there's a issue with a family member that they need to go out of town with? I know when you and I did this session back in November for the Pflugerville Seniors Conference, we were talking about travel, and you said that one of the most dangerous places to catch the virus was in the waiting terminals at the airport. It wasn't the airplane, it's in the terminal where you're sitting around with everybody else for an hour waiting on the plane.
Right.
So what kind of precautions should we look for if we're needing to travel?
So it's the same thing. So, right, higher risk and crowded, poorly ventilated areas. Airports are crowded, poorly ventilated. You do get ambient airflow in airplanes, which helps a little bit with reducing transmission. Still crowded, right? So it's the same thing. Wear your mask, social distance as best as you can. If you need to travel, that's kind of a decision you have to make individually. And if it's worth the risk to you. Now, if you're vaccinated, obviously the risk of getting severe disease is a lot lower, but still, wear your mask and wash your hands.
Excellent. And speaking of masks, you said even after you get your second dose, still continue wearing the mask.
Mm-hmm.
And I know that the CDC is going to be recommending that everyone continue wearing masks until we reach herd immunity. Is that what you're hearing as well, that it's going to be something we're going to be dealing with probably through the rest of this year?
Yeah, probably. And what's kind of interesting is we haven't had much flu this year, so maybe we keep wearing our masks during flu season. We'll see how the seasonality for COVID ends up being, and if it's just something that hangs around all year and is endemic in populations that haven't been as vaccinated or not, or if it springs up yearly like flu. That's all things that are still being determined. We don't know the answer to that yet. But yeah, at least until we reach herd immunity, that recommendation is not going to go away.
Yeah. You mentioned flu, and I know that you mentioned the possibility of booster doses with the vaccine. Do you suspect that this is going to be one that we'll just add to our list of annual vaccines like flu and pneumonia and ones
Probably.
that we
Yeah, and we don't know if it'll be annual yet, biannual, who knows? That information we don't have yet as variants develop. It'll be really after, I think, we reach herd immunity and what new variants pop up after herd immunity is reached. And then we'll be able to kind of figure out what the flow and pattern of COVID will be year to year.
Right. And speaking of the variants, the two vaccines that we currently have available, are they showing to be pretty effective against the variants that we're seeing showing up in the United States?
I think they're looking at the California variant. So I don't have information on that yet. As far as the UK variant, it's still pretty effective. It doesn't lose much efficacy. The South African variant, it does lose a little bit of efficacy. But overall, it's still really a good vaccine.
Right. The fact that we have something is better than nothing. And
I mean, you go from maybe 90% to 70%. That's still better than 0%.
Exactly.
Yeah.
Most certainly. And we even know that, some of the flu vaccines, because with the flu vaccine, we have to make a guess every year in advance of which strains of the flu are going to be coming out this year. And those guesses have to be made, in the summer to start with vaccinations for the fall. And some years, we've got 90-something% effectiveness, and some years we're in 70-something% effectiveness with the flu vaccine, but it's still better than having no vaccination at all.
And the flu vaccine it prevents severe disease and it prevents death. So it still does what it's supposed to do, even if it's not like, 90%, and maybe it's 50, it has down to 50% sometimes. So it still does its job.
Right.
And that's what we want.
We mentioned the Johnson & Johnson vaccine that they've asked the FDA, I saw this morning, that FDA is looking at giving the approval for it as emergency usage. It is a single dose as opposed to the 2 doses of the ones that we have currently. What is the difference between the ones that we have now that is a dose and a second dose with the booster, and then one that is just going to be a single dose use? Is there, I'm sure that the single dose is not as effective as 2 doses,
Correct.
but are there any major differences between those 2 vaccines?
This is the way that Johnson & Johnson one was studied as a single dose, but again, its base is different. It's based off a different virus. So its base is an adenovirus. It cannot infect you, so don't worry about that. Its effectiveness isn't as effective as the 2 doses of Moderna or Pfizer, but it's still really good. It's above 70% in some areas. To be determined how effective it is with the South African variant, but we did see it, I think, when I pulled up that slide before the South African variant was a bit lower. I don't recall the number. So the efficacy will change as the virus mutates, and that's again where boosters will come in the future when we need them. So that's the difference, is a single dose. I think the cold chain storage may not be as, the temperature may not be as low as the Pfizer or Moderna, which is helpful, and that's helpful in getting it to resource poor areas. And so it'll have its role, and it'll be very, very effective. I think overall, any vaccine, get it when it's available to you and get it when you can. And I think, there'll be more studies coming out with the 2 doses of Pfizer and Moderna, and showing what the efficacy is after a single dose, which I think is going to be pretty good.
Yeah, and you're exactly right with that Johnson & Johnson one, where we don't have to keep it as cold as the other ones. That'll be very helpful, especially like rural areas of Texas, where it's difficult for people to get in, especially older adults, to get their vaccine, and having to take it to them and being able to keep it cold the whole time on the trip sometimes is difficulty. So this might be a better way of reaching some of those outlying populations that we have.
Oh, for sure. Yeah.
We've seen a lot in the news about the effects of people who have had COVID, that they develop some of the symptoms like loss of smell, loss of taste, other body issues, and that those symptoms seem to last after the recovery time. Have we seen any new information about how long possibly people are going to have to live with those after effects after they've been infected?
So the data still, isn't great yet as far as that goes, but it does seem, some people get a post-viral syndrome, and there's a lot of other viruses that have good data, like mono, with post-viral syndromes, and sometimes those symptoms can linger, and they can linger for a while. Uncommonly, it's, for mono at least, it lingers for over 6 months and over a year sometimes. So COVID, we're still determining, we're coming up on that year mark for some people, but not everybody gets post-viral syndrome. So we're still collecting that data and that information. The patients that I have seen that get it, they do slowly get better. Some people get better quicker. Some people take a little bit longer to get better. So to be determined.
Okay. And of course, every human being is different than every human being. And so there's always other underlying things that are going on in our bodies that can cause symptoms to last longer or symptoms to go away quicker. So it's right, like you said, right now, there's so much that we still don't know about this, and we're learning as we go. I remember when you and I talked about this in November, you said that we're making a lot of best guesses based on how other viruses operate. And so we're looking at what we've known for decades of study about related types of viruses, but because this is a new, unique thing, it has its own little quirks that we're still trying to figure out. So, we've learned a lot in a very quick amount of time, but there's still things that we're not sure about. And so I know it's very discouraging a lot of times to look at the news and see something new that we've discovered, and it seems very scary, but that's just what's happening historically with this.
Mhm.
I've got a question about caregivers who are taking care of grandchildren,
Mhm.
and that they have not been able to get their vaccines yet. And of course, with the kids, some of them are back in school physically.
Yeah.
And we know that a lot of the transmissions have been happening from children to older adults. Are there any specific precautions that we need to be taking if we've got young people in our home?
Yeah, nothing more than we've been doing. It's just best you can wear your mask and wash your hands. And once you get vaccinated, the risk, is a lot lower, but I can't tell you not to stop wearing your mask until we reach herd immunity. So kind of going into that, a lot of kids seem to be asymptomatic. There's some information coming out with the newer variants that may cause more illness in some of the kids. So if they are, and it's hard to know, right? Because when kids are around other kids, they get really sick, they get, runny noses and all those things. So it's hard to know. So it's just monitor the best you can symptoms, and do what you have to do.
And that's a good point. Here in Texas, we have allergy season year round.
Yeah.
And there are a lot of the same symptoms between allergy and COVID. So what's a good rule of thumb of, if I'm not feeling that great, might it be allergy, might it be flu, or should I be concerned that it's COVID?
Yeah, if your usual allergy regimen isn't working, you're having fevers, and then there's kind of weird changes in your taste or smell, or you're getting additional symptoms like body aches you really shouldn't get with allergies, nausea, vomiting, diarrhea, that shouldn't happen. So if you're having other symptoms that are more typical for COVID, think COVID, or if you've had some exposure that you know about, think about COVID as well.
And we've kind of changed the conversation around COVID publicly from go get a test to go get a vaccine.
Right.
But want to remind you that testing is still available for free throughout all of Texas.
If you think you have COVID, go get tested.
Yeah, most definitely. Because, if you catch it early, yesterday we talked a lot about dementia, and we talked about early detection and how important it is for early detection with dementia, because you want to catch it early because there's things you can do about it. The same thing with COVID. If you're not feeling great, talk to your doctor, schedule a test, contact the public health in your county where you are, get that test, because they're still doing lots of testing, and it's all free. And it's better to know if you have it, because there's things you can do now than it is to go full blown and then nobody wants to be on a respirator in the hospital.
Right. So most of the treatments we have available for COVID are most effective early in the disease process. So early from symptom onset. And that's just because a lot of them act directly on replicating virus. And most of the time we stop replicating the virus after about 8 to 10 days, depending on your immune system. So if you have a normal immune system, after about 10 days, we can't culture it. So we know it's not really actively replicating. So if you're feeling ill early on and you're hypoxic, meaning your oxygen is low, you really should go seek help.
We had some questions about utilizing home health during the COVID epidemic. We talked about it yesterday. Yesterday's whole session was about home health. I'm sorry, that was on Monday. I'm getting my days all mixed up. Monday, we did a whole session on home health, and actually that video is available on the H of Central Texas YouTube site. You can just go onto YouTube, Google H of Central Texas, and it'll bring up the whole playlist. But there's a lot of concerned people who need to have a caregiver come into the home and need the home health services, but they are obviously concerned about having someone outside of their bubble coming into the home.
Right.
Even though we know that all of our home health providers are taking COVID very seriously and they're testing all of their folks, what are some of the things that we could do as the care recipient and the care partner of an older adult that we can help to mitigate any of the concerns about COVID coming into the house with home health coming in?
I think pre-vaccine, definitely higher concern. I would imagine every home health company has some policy for, testing their workers every day, and monitoring for symptoms. And then I don't know, I'm sure they fall somewhere within the tier 1B or A. So most of them should at least have been vaccinated by now or in the process of getting vaccinated. And so that should really, decrease the risk significantly.
And also, don't be afraid to ask the home health.
Yeah, don't ask. Yeah, how are you feeling today?
Yeah. And ask the company, what is your COVID policy? What are you doing to mitigate the spread of COVID of your healthcare providers coming into people's homes? They're all masking up, they're wearing gloves, they're using disinfectants and all the things they're supposed to do. But, ask them, what are you doing to make sure that my mom or dad is safe? So, always ask those questions. Got a very specific question about one of the ingredients in the approved vaccines. And I'm probably going to slaughter the name of it. We're going to give it a try, that it's hydroxychloroquine.
That's not in the vaccines.
It's not in the vaccines. Okay.
No, that's an anti-malarial drug that's actually given more so for autoimmune illnesses now. So I don't, not as familiar with the side effects for that, but at least the studies for hydroxychloroquine did not seem like it was effective for fighting COVID. And it kind of makes sense because it was developed for a parasite, not for a virus. So the mechanism of action doesn't quite make sense, but that should not be in any of the vaccines to my knowledge. You can always check the FDA website and the CDC for the ingredients to all the available vaccines, though, if you want to confirm that.
Super. And then we also have a question here about issues of depression with our older adults. First came the lockdown, and we're going on now almost 12 months of having to social distance and isolate. And that's a very hard thing to do for anybody to do, but especially for older adults to not be able to see their loved ones in many cases. I know when we talked in November, we had one person who said, I haven't had anybody touch me. I live alone, and I haven't had someone touch me since March. And that's a heartbreaking thing to hear, but unfortunately for some people who are very high risk because they have other symptoms and other physical issues. How do we deal with just the depression of this? And this week having crossed the 500,000 mark of people who've died from this disease, and those things. It's every time we turn on the news, it's something else that's making our hearts hurt. So how do we deal with the depression issues that come about from this coronavirus pandemic?
Yeah, that's, it's hard for everybody, right? And my heart goes out to those people who, continue to be in strict isolation and haven't been able to have contact with people. That's hard for anybody. I don't know what resources AGE has to kind of help, like, groups, you can do on the video visits or, Zoom chats. But I don't know 100% how to answer that. I'm not a psychiatrist and I don't do primary medicine, but I can tell you everybody has been depressed and have anxiety at some point during this, and being isolated at home alone is going to affect everyone. So we're all kind of in the same boat, but I will say there is a light at the end of the tunnel. We have vaccines that are very effective and they are working. So there's a light at the end of the tunnel. There will be an end to this. I don't know when, but hopefully this year.
Yeah, I know it's been really difficult for everyone. One great resource here in Central Texas is Nami Central Texas. They are provide free mental health services, and they are a great one to contact. We partner with them often. We also have a brand new program called Virtual Connections here at Age of Central Texas that was designed specifically for older adults who are isolated, and particularly those who do have a cognitive issue such as Alzheimer's or other type of dementia, where they can participate live virtually in activities. And so that was, we developed that when we had to close all of our in-person programming, and we were able to pivot to virtual. There are lots of resources that are available here in Central Texas. If you are having depression, that you can get free help. You can contact Age of Central Texas. We can connect you to those. I know that Riverbend Church can also connect you up. Riverbend, in addition to Age, has support groups that are meeting virtually every week, and those are available as well. And then the Area Agency on Aging, who is our pass-through money here in Central Texas of the Older Americans Act. The Area Agency on Aging of the capital area has a tremendously amazing service with their resource center. And they can also connect you up with resources. They can also, for the caregivers, they can provide respite for you if you're just needing a break. They can provide short-term respite that they will pay for someone to come and stay with your older loved one so that you can take a day or so off. If you want to, just go stay in a hotel for a weekend, just get away. They'll help take care of that. So there are lots and lots of those resources that are here available. And I've said this all week, and I'll say it again. There is never, ever, ever any shame in asking for help, because every one of us at some point in our life is going to need some help. And especially with caregivers, because this is a very difficult journey already without throwing a pandemic in on top of it and a major winter storm as the icing on the cake. It has been a very, very hard 12 months for all of us. So there is never any harm. There's never any shame in saying, I really need some help. I need a break. I'm up to my eyes. I need some help, because that's why organizations like ours exist. Baylor Scott and White Health provides a lot of wonderful services that are free to the community. And so you can reach out to them, reach out to Riverbend Church, reach out to Age of Central Texas. We're all here to help because we all have the same goal. We want Central Texas to be the healthiest place to live, and we want everyone to have the same quality of life, and we want it to be as high as possible. We appreciate you so much for joining us this morning. Dr. Theoktisto, we appreciate so much all of your expertise and your knowledge and being willing to share that with us today. We thank all of our attendees for joining us today. A reminder, we will be posting this video on YouTube, so you can share it with friends and information. If you have other questions that we didn't answer for you today, get in touch with us. We will answer those questions for you. Remember, we'll be back tomorrow once again with another great session, and then we'll be back Friday to wrap up with our final session, 10 o'clock, both of those days. Big thanks to Riverbend Church for having created this amazing conference and giving us this opportunity to share the information. Thank you to Baylor Scott and White Health for their support. Dr. Theoktisto, a huge thank you for you. You're such a valuable part of our community, and for sharing your information with us. We are very, very grateful. We hope that you have a wonderful rest of the day. Keep your eyes open for the emails that will be coming with the program and all the resources, and we hope that you will join us again tomorrow. So have a wonderful day, and we'll see you tomorrow. Thank you so much.